Good morning, everyone. This is Dr. Steve Aldana, the CEO of WellSteps. I wanted to welcome you all to our next webinar today, Wellness in the Affordable Care Act, What You Need to Know. Joining me today is going to be Dr. Troy Adams. He's our Director or Chief Operations Officer at WellSteps. And to be honest with you, nobody knows more about the connections between wellness, the Affordable Care Act, compliance than my partner, Dr. Troy Adams. We're in for a treat today. I'll be starting this off. Behind the scenes, I have Jenny Irvine, who is going to be looking through your questions. If you'll notice on the right-hand side of your screen, there's a control panel. You can ask a question at any time, whether it's administrative or regarding the content. We're going to have plenty of time at the end to get to your questions, so fire away. Jenny will be behind the scenes with myself going through questions. The slides for today's webinar, as always, are posted at wellsteps.com. Just click on the webinar's link and you can download those slides. We encourage you to use them any way you possibly can. So let me introduce Dr. Troy Adams. Troy received his PhD at the University of Texas at Austin, was in academia for several years where he and I crossed paths until about 7 years ago we joined together to create WellSteps. He's a consultant, he's an author, he's a researcher, he's a fabulous partner in all of this, and quite frankly, very, very few people understand the nuts and bolts of effective wellness programming like Dr. Troy Adams. I'm honored to have him as a partner, and I think you'll enjoy what he has to say today. I'm going to turn it over to Troy. I'll take the screen back for just a moment to introduce another topic, and we'll be on our way. Troy, take it away.
Thank you very much, Steve. I just want to correct one thing you said. I think there are probably a lot of people out there who understand more about the Affordable Care Act than I do, but I doubt there's anyone who's worked as hard to explain it simply as I have. And so that's what I hope you get out of this webinar today, is this simple understanding of the things you need to understand based on the Affordable Care Act. I just wanted to also remind, some of you might be new, you can participate in the webinar by posting your questions on the GoToWebinar control panel, which appears on the right side of your screen. Because this is a large webinar with almost 1,000 people, we've had all the phones muted so that we don't get any background noise. With that, let's go ahead and dive in. So if the Affordable Care Act has left you feeling like this, or maybe like this, or maybe even like this, sweating bullets, I got news for you. You are not alone. Now, this is not a political statement. This is just a statement on the fact that anything that comes from the government can sometimes be confusing, and it's okay. But you know what? I'm here to tell you that I've got some good news, some really good news. Today, we're going to explain the details in a very simple way, and it turns out it's not all that complicated, this whole Affordable Care Act thing as it relates to wellness. And I know a lot of you are going to have questions, and some of the questions will go something like this. Well, at our company, we do A and B and C, and we require our employees to do X, Y, and Z. Are we good? Are we covered? Are we compliant? Very specific questions. From past experience, I know we'll get a lot of those at the end, and that's okay. We'll get to as many of those questions as we possibly can, but I'm going to invite you just to belt in, tune in, and we're going to try to, in a very general way, answer all those questions. So if you listen carefully, you might even be able to answer that question yourself. That's primarily what I plan to do in this webinar. Now, a few of you may be on the webinar today to find out how ACA applies to you individually. I got a few emails like that. Somebody wanted to know about Medigap insurance and things like that. That's not going to be what I focus on so much today, but the good news is we're going to do another webinar on this topic. The thing is, when we began to prepare, I began to prepare really for this webinar, and I started to look at all the content. The list of things to cover just kept getting bigger and bigger, and Steve and I have talked about this back and forth. We decided to split the content in half. So, like Hunger Games and all of your favorite movies, there is a sequel coming. And I'm pleased to announce that Steve is going to be doing that sequel. He's going to give you a sneak peek right now. And if you'd like, we encourage you to register for that webinar. It's going to be a month from now, just as soon as this webinar is over. So with that, I'm going to toss back for a minute to Steve, who's going to talk about the next webinar.
Wellness wins the prevention lottery with the Affordable Care Act. And there's an awful lot of media coverage about defunding and throwing it away. I'm pretty sure, and I think most people are too, it's here to stay. It might get some changes, but let me just tell you briefly how this has dramatically changed how we do wellness. On a very personal note, my own family, our own individual plan, this is back in September of 2010 when the Affordable Care Act was officially approved. You could make changes to your plan, you could become ungrandfathered, and you could get the preventative services that are available. So just to briefly tell you, since the Affordable Care Act kicked in, I have received two checks from my insurance carrier, just plain checks out of the blue, because they're exceeding their medical loss ratio, which means they're charging too much for their services. I've gotten two checks in the mail, and we've received a free mammography and a free colonoscopy in this family, which was about $2,300, which was free, which wasn't free before then. And my premium went down $100 a month. Now that happened almost 2.5 years ago when we made those changes. Those are huge changes for an individual plan like myself. Well, when we talk about the lottery and prevention, some of these changes are going to have an impact in the way we do wellness. And preventative services are now available to every single employee who is a part of the ACA. That brings this idea of grandfathered and non-grandfathered and what it really means. And some employees, we're going to talk about how to help employees benefit from these services. Let me just show you one slide here and a link. Troy, let's go to the website where these preventative services are listed. Troy's got this pulled up on his screen, and you can see this is from hhs.gov. The link is in the slides that you're going to get today. These are a list of all the preventative services that are covered for adults, children, women, pregnant women. It's amazing. Biometric screening for cholesterol and blood pressure. For those that are above 35, for males or at risk, it's free. Colonoscopy is free. Diabetes screening is free. Obesity screening is free. Your flu shots are free. The list goes on and on and on and on. There's a huge number of ideas here. Now, just to break for a second, the reason we're all on this call today is because we're involved in worksite wellness programs. Our goal is to improve employee health and to lower healthcare costs. So when we look at this Preventative Care Act and the preventative services with ACA, we're talking about preventing cancers. We're talking about preventing premature births. We're talking about preventing pneumonia or influenza. The question now becomes, are these cost-effective things that we should be doing in wellness programs? If I'm a fully insured person like I am, and many of you are, it's part of my premium and they have to pay it. If I'm part of a company that is self-funded, well, guess what? Your company, if they're self-funded, is going to pay for this. So this is one of the items on this list. Should you be doing this if you're a self-funded plan? Because you have to pay for these by law. What data do we have that says you're going to save money? With the cancer screenings, with the premature births, those are big dollar items for self-funded groups. So what tools can you find and use to help you use these preventative services? How to get your employees and spouses to do them? What impact does it have on self-insured groups? That's a big one. How can these be tied to benefits and benefits efforts, and so, or incentives? And then the last one is, what are some of the common ways that these prevention efforts fail? There's a whole webinar on this, or two or three. I look at this as the single biggest opportunity for wellness to improve the bottom line that we've had in a long, long time. We've got some great things to show with you, and that's going to be next month, Troy, October 25th. We'll probably show that to you again as the webinar. It's already posted at wellsteps.com. It's an unprecedented opportunity for us to prevent disease and do what we're paid to do: improve employee health and lower healthcare costs. Troy, back to you.
All right, thanks, Steve. That's a webinar that's going to be really great. I too had a personal experience with the healthcare system. I'll spare you the details, but not unlike Steve. So, just to get you back on the webinar topic for today, we're going to discuss the details of the Affordable Care Act as it relates to wellness programs. We're going to try to help you learn what kind of wellness program you have. There are really only two. And so you need to listen for these two and kind of decide which is yours. And there are some things you need to do if you've got one certain kind of program. And then we're going to help you understand the things you need to do, including giving you some tools to help you be compliant with some of the details of the Affordable Care Act, really, really simply. And then we've got some question and answer. We had, again, several questions that came in before the webinar even started. We've preloaded our slide deck with those questions and some answers to some of those questions. So we'll get to those and to your questions as well. Again, type those on the GoToWebinar control panel. Choose the question button and type away, and we'll get to those, as many of those questions as we can. So to get started, what I'd like to do is just start with a little story. I've got a 22-year-old special needs daughter. She is awesome. Everybody who meets her loves her. One of the things she really, really loves to do is to play church volleyball. And the ladies are great. They engage her, and she even got a ball over the net one time because the ball hit her in the head and bounced over the net on accident. It was great. It was the best day of her life. Well, if so, some of you may not know about volleyball, and so you need to know that right there, that represents the net. That dark blue line is the net. This is the service line. And normally in a volleyball game, you got to serve the ball from behind that line, and if any part of your toe touches that line, your serve is no good. Well, my daughter cannot serve the ball over. She can't even reach the net from that line. And so what they've done is they've adapted the rules just for her. She stands right there. And so that's the 6-foot line. She stands right there, and she's able to hit the ball over the barely over the net. They play the ball as if it's live. They all have a lot of fun, and my daughter's included. So what I have figured out and thinking about or reading about and studying the ACA, the 123-page document several times, is that really the ACA is a government's attempt to make all of this wellness stuff fair. Just want to make it fair for everyone. Now, fair is a fancy way actually, it's a simple way of saying that it is non-discriminatory. That's a big, scary word to hear from the government. But the bottom line is, it's the golden rule. Is what we're doing fair to everybody? Now, I don't think it's a great idea to explain something by what it's not. So if you'll forgive me if I say fair instead of non-discriminatory. The basic question is what we are doing in our wellness program fair to everyone? That's the entire point of the ACA legislation. The legislators, I could see them sitting around saying, well, what about this kind of person? What about that kind of person? They just want companies who provide employee wellness programs that have any sort of financial benefit or incentive to do so in a way that is fair. That's it. So let's get started. To really understand what we're going to be talking about today, I've identified two things we need to define, just two. So to understand what kind of wellness program you have with respect to the ACA, one of our objectives, we need to understand these two definitions. The first is of a health factor. Now, a lot of you have heard this. Well, I don't want to go in a lot of detail over this, but health factor includes health status, which think about the things that you do when you go to the doctor's office. You step on a scale, you put an arm in a blood pressure cuff, they put a thermometer in your ear, or they or in your mouth or wherever they happen to put it. And, they got all those measures, maybe biometric screening. Those are sort of all indicators of health status. So things like blood pressure, cholesterol, glucose, think of those as health status indicators. The next is medical condition. That includes any physical or mental illness that you might have, things for which you go to a doctor that you happen to be having problems with of a physical or mental nature. Claims experience or history, including recent receipt of health care. We have to be fair to the people who've been to the doctor a little bit more normally than maybe everyone else. Medical history or genetic information. And we know that your medical history or genetic information, that includes family history. And there was a big hubbub a few years back about family history related questions in health risk appraisals. And a lot of people in the industry have gone away from using family history questions on the health risk appraisal. We never did, because our emphasis has always been helping people identify and change things that they have control over. And there's really not much you can do about your parents once you're here. And then lastly, evidence of insurability. So that includes conditions that arise out of acts of domestic violence. So any evidence that would be provided to a health insurance or even a company, you can't discriminate against people based on that. You've got to be fair. And then lastly, disability. And that includes a whole host of things that limit the way we're able to do things. I've got a mother who's in a wheelchair, so I understand disability pretty well. So basically, it's not okay. The government is saying it's not okay to hide behind a wellness program while singling people out based on any risk factors, illnesses, disabilities, and any claims or medical history. We can't provide rewards or penalize people for any of those reasons. All of that together is called a health factor. So a health factor is any of these things. And that brings us to our next definition. That is, what is a reward? So a reward is something for which we give a discount or a rebate. That could be a health insurance premium. It could be just about anything you could think of. Waivers, anything with monetary value. Yeah, gift cards, those are all considered rewards. And then there also are included in the ACA penalties for not doing healthy things, like surcharges. So if you're a smoker, maybe some programs are set up so that if you're a smoker and they can prove it because you've got high values of serum cotinine, that there's a surcharge, a penalty, any other disincentives, anything else with a value attached to it. That's you pay if you're not healthy. That people who are healthy do not pay. That's a penalty. Well, the great news is that in the ACA, all of this, whether it's a reward or a penalty, it's all called rewards, because the idea is the people who are healthy are getting a financial benefit, whether it comes in the form of I'm getting money back or I don't have to pay money. That's all viewed as a reward. So isn't that great? This is one thing that they actually got right. It's really, really simple. So anytime I say reward, I'm referring to what might be constituted as a positive reward, and anything that might be construed as a negative reward or penalty. All right. So with that, we're ready to dive in. Are you ready? So let's talk about types of wellness programs. And again, there really are only two. The first is called participatory. And I have to be honest, I really dislike that name. And I know it appears in the official um, legislation, the ACA legislation, and I just think it's a big, long, goofy word. I even have a hard time pronouncing it. I have to slow down before I say it. So uh, because it's really just a program where you're just asking people to engage, for crying out loud. I'm going to go ahead and just call it an engage program, if that's all right. So any program that in which you just ask somebody to engage, just a participatory program. What it means in practical terms is that the reward is not based on any of those health factors that I showed you, or there might not even be a reward at all. So if that's the case, then you've got a program that where you're just asking people to engage. So engage just means participatory, just so you can kind of keep score. Well, let's give some examples, because I know a lot of you are asking questions. Well, I do this. So here are three examples of what we call engage programs. Again, engage means participatory. We have a customer who did a biometric screening program. They invited everybody in, and they gave rewards out based on whether or not you did the screening program. Period. That's it. There was no further action required based on any of the data that was produced. The vendor didn't, the wellness provider didn't get it. That was us. The the customer reps didn't get it. There was no further action required at all on the employee's part. So the incentive was based on doing, just engaging. It was a clear case of an engaged program, and this actually comes right out of um, the ACA guidelines. This particular example. So some of you might, well, I think that's this kind of program. No, look in the examples of the ACA document. That's right out of their example. What about this? Tobacco cessation with no quit determination. Now, I've talked to companies, some of whom are our customers, who want to provide a tobacco cessation program, and for good reason. But they're worried about coming across as too big brotherish. So what they do is they stop short of any determination that an employee actually quit after engaging in a cessation program. So they want you to go. They encourage you to go. They give you all the tools and the resources that you need if you're a smoker. They hope you quit, but they're not going to force the employee to prove that they actually did. It's a great example of an engaged program. Right? So there's a reward. I'm going to pay you to go. I'm going to buy your stuff, and I hope you quit, but I'm not going to check back to find out if you did. That's an engaged program. Participatory. So third example, personal health assessment required, but no action required after the fact. So you all know that sometimes HRAs, or health risk appraisals, we call ours a personal health assessment. They require health coaching or health education classes or some other intervention depending on the risks that are manifest in the health risk appraisal. But in an engaged program, there's no action required based on the results, even if a reward is given. You're rewarded just because you engaged, just because you did it. Personal health assessment with no action required. That's an engaged program. So to summarize, you're asking people to engage, but the reward is based on participation only, or what happens that you don't offer a reward. So they're fair. A program is fair. These are all examples of an engaged program. And the great news is, if you've got a program that's considered an engaged program, you are good. You're fine. You can continue listening to the rest of this webinar, but none of the rest of the stuff that I have to say is going to apply to you. All right, so the second kind of wellness program is called health contingent, which, wow, that's even worse than participatory. That's just a really big word. So I think instead what I'm going to do is I'm going to call this achieve, because the employee has to achieve a standard in order to qualify for the reward. It's like a high jump bar. There's a standard there you've got to clear, and if you can't, you've got to do something else. There's an achievement based standard. So we're going to just call that achieve. It's going to be easier. So there are really two kinds of this sort of program. One is based on outcomes. There's an outcome based standard. That's the one with which most people are familiar. The employee has to achieve a health factor based standard. Most common ones are things like blood pressure, which is the one I recommend the most, body mass index, glucose, cholesterol. You achieve that standard, you clear the high jump bar, you're good, you're fine. But if you don't, then there's an additional requirement. You've got to get that number under control. You've got to participate in a program. You've got to go to a class. You've got to visit your doctor. There are any number of we call those alternative standards or options that you got to give the employee in order to help them get to the point where they meet that standard, where they can clear the high jump bar. So that's an outcome based standard. It's just a type of an achieve program. The second kind is activity based program, where you're asked to do something, or employees are asked to do something that might be unreasonably difficult or even unsafe in order to qualify for a award. So the best way to explain these is just to look at some examples of both of them. So here are some examples of an outcomes based program. So you've got to be smoke free. And sometimes that's just a signed affidavit. Sometimes it's a blood test where they look at the metabolite of nicotine called cotinine to verify that you really are smoke free. And if you're not smoke free, you've got to go to a smoking cessation program. And then you've got to, maybe there's a quit determination. You've got to make sure that you've quit, or at least document that you went, or something like that. So that's a good example of an outcomes program. You have a BMI under 30, or you got to go to a weight loss program or some other type of program. Your glucose has to be under 125, or you got to go to a healthy lifestyle program where you modify the things you do so you can get your glucose under control. We're going to discuss how to modify these programs to make sure they're fair for everybody here in a little bit. That has to do with, if you've got an Achieve program, there are certain things you need to do. There are 5 things you need to do. And we're going to talk about those 5 things in detail. And I'm going to give you some really simple examples that you can use. So, again, for this type of Achieve program, and outcomes based is standards based on a health factor. Something gets measured, it's a high jump bar, you've got to clear it. If you can't, we're going to help you clear it by giving you some option. All right, so remember all these examples of a health factor. That's just to help you remember. If your high jump bar is a health factor, boom, you got an outcomes-based program. Other examples of achieve programs, just what if they're activity only? Now, this one was the most confusing to me. I had to study this for several days before I realized, okay, this is about fair. What if you have a walking program, which on face level is a great idea? Let's take everybody walking. If there's a financial reward, if there's a reward, remember the definition, um, but I can't do the walking program because I've got asthma, or if there's a diet program, but I can't do that because I'm a woman who's pregnant. If there's a physical activity program, but I just had surgery that prohibits me from doing it, it's not fair for you to give money to people for doing those kinds of things, and I can't do it because I'm physically unable. Then those are great examples of an activity only program or an activity program. So you have to make sure that there are options available to make it fair if people can't do those activities. So I'm calling those, all of this is, we're going to call this achieve. So engage and achieve. Now here's the deal. If you've got a program that is again, an engaged program, then you're good to go. You don't have any worries in the world. If you've got a program that's an achieve program, then I need you to listen up. So what kind of wellness program do I have, and why is that important? So that's the first thing. Hopefully you've been able to determine which kind of program you have, and why is that important? Well, if you've got an engage program, you're good to go. Again, if you've got an achieve program, then there are things you need to do. There are 5 rules for an achieve program, and we're just going to cover these. We're going to cover these in as much detail as we can. So the first rule: if there's a reward attached, then your employees have to have the opportunity to qualify every single year. That's pretty simple. I mean, I know most companies operate on a fiscal year. There's a fiscal year budget. There just has to be an opportunity. If I pass this year and I decide that high jump bar is just too high for me this year, I'm going to work a little bit, I'm going to pass, you got to give me a chance again next year. It's got to be annual eligibility. That's pretty self-explanatory. People get tied up on this one a lot. So the reward can't be bigger right now than 30% of the total cost of healthcare. And somebody's going to say right now, well, what about tobacco users? That's 50%. That's true. Let's not complicate the matter. We'll come to that in a minute. Let's just focus on this 30% number right now. The total cost of healthcare. Now, what does that mean? That's the employee plus the employer share. So if an employee paid $1,500 a year for health insurance and the employer paid $4,500 a year, then the total would be $6,000. 30% of $6,000 is $1,800. I don't know. In fact, I can't think of one company that gives out $1,800 in rewards, even in premium discounts and waivers, that even approaches that. The average for the premium discounts probably around $50 a month per employee. You do the math, 12 times 5, we're not even close. So for most people, this doesn't really come into play. Most companies are not going to give more than $1,800, but that's a limit. You can't give any more than that. Why? Because the government has said this is the limit of fair. You go bigger than 1,800, now you're getting unfair. So we're going to limit you to $1,800. We think that you can keep it fair within that reason. So reward not bigger than 30% of the total cost. It's got to be a reasonably designed program. That means there has to be a good chance in the program of actually improving health. It can't be overly difficult. Specifically, they say things like it can't be a smoke screen for discrimination. It's got to be fair. And we often talk about the core elements that have to exist in an effective wellness programs in our webinars, and we use this slide a lot. This is one of the best slides that we have. You've got to provide awareness and education. You've got to provide motivation for people to change their behaviors and improve their health. You have to provide tools and skills to help them do that. And this is where a lot of people fall short. And then it's good to change the policy and environment where the healthiest choice is the easiest choice. We call this the secret sauce. It's the reason that we show it so often. So if you're looking for a good model of an effective wellness program, this is it right here. We have long based our solutions on this model because it's really well grounded in the research. And I think it's interesting that some state-based wellness funding initiatives that have come across my desk in the last couple of weeks have very specifically and blatantly used this very model as a basis for reviewing RFPs. Interesting. So, program has to be reasonably designed, and it's got to have a chance to improve health. There has to be, if you've got a high jump bar, you've set that up for your employees, and it's blood pressure. My blood pressure's high. And I just can't get my blood pressure low for whatever reason. There's got to be an alternate standard that still enables me to get the reward. In other words, it's got to be fair. Some people call this an exemption. It means if you can't run, then you can achieve the reward by walking. If you can't walk, you can achieve it by doing some alternate form of physical activity. I told you that my mother has been in a wheelchair. She's been in a wheelchair since 1963. Her physical activity for a number of years consisted of walking on crutches down our hallway and back. That was all she could do. She did it every night. She was physically active, and I would say she met the alternate standard. So if you can't meet any physical activity standards because you've got a doctor's note, then by law, the alternate standard can be waived and the reward provided anyway. That's just the way the law reads. So here's the great news. If you're a wellness program person, professional, or you're in health benefits, or you're a broker, you don't need to come up with an alternate standard before someone asks for one. Why? Because if you come up with a rock solid alternate standard, somebody's going to say, well, I have this problem and I need this to be modified. Your alternate standard probably is not going to meet their needs, so it's not going to be fair. And so you can wait until somebody asks you for an alternate standard before you come up with one that is going to work for them. It winds up being a very personal, individual thing. You just have to work with people when they ask for modification. And I'll show you how we do that at WellSteps in a second. It's actually pretty easy. So here are a couple things about the alternate standard. These four words you need to remember. So if an alternate standard needs to be used, and your alternate standard is to refer an employee to a program, you can't say, hey, go find a program to help you reduce your cholesterol or your blood pressure. You have to suggest one. So one of the requirements you have, or the responsibilities you have as a wellness professional, is to find a program that you can suggest. The trick is you've got to be able to provide a suggestion where there's no cost to the employee. That either means it's a free program available through the community, or it's a program that the employer pays for. So there can't be any cost to the employee. So it's like saying, look, I understand that you can't clear this high jump bar. All you got to do is give me $100 or pay somebody $100, and then we'll just kind of look the other way. That's sort of not fair. And it's not really, there's all kinds of problems you can see with doing something like that. So you got to suggest a program. It's got to be free. The time required has to be reasonable. What is reasonable? Well, in the ACA, they say an hour a night is not reasonable. I personally think traffic school is highly unreasonable, having been there recently. So it's got to be a reasonable amount of time. And then one of the suggestions, and I'm going to tweak this a little, I'm just going to say that one option you should always include as an alternate standard is for them to employee to comply with physician's orders. So that should be an alternate standard, because the physician model is that the physician works with the individual person and will kind of verify what is appropriate and what's not appropriate. And we just call that a doctor's note. You've got a doctor's note and you've met the conditions in that doctor's note. We're going to consider that you've met this alternate standard and you're good to go. So that's the fourth thing, that you have to provide a reasonable alternate standard or an option, another way to clear the high jump bar. So then the fifth and final rule that you have to achieve is that you have to communicate the alternate standard to employees. You got to let them know there's another way that you can qualify for this reward. So here's how we do that. We have at WellSteps, we have a program we call Rewards. Not to confuse, but it's just a list of monthly activities that the employees do. They check off, they earn points, and they can redeem the points for prizes: gold, silver, bronze rewards. And etc. So one of the things we did is in the links button, and we got an email where we communicate about this. We include a simple note, a PDF, where we say, you know what, thanks you for your participation in Well Steps, and we just want to help you be healthy. We think that should be fun. We're giving you prizes, so because it's fun. We also think improving your health should be simple. It's not complicated. People have a hard time doing it, right? So it should be simple. Even so, we know that some of you might not be able to do what we're asking you to do, and that's okay. If you need us to help you by modifying an activity, here's how you do it. Just contact us. Click the contact button. There's a Well Steps guide. Send us an email. So now we have a record, right? Your guide will work with you to modify that activity so you can still qualify for the prize. So you've required me, Well Steps, to walk 3 times every week this entire month. I can't do that because I had surgery and my doctor told me that I have to kind of take it easy for 2 months. So there's an email exchange that we've now got a record of, and we say, well, what can you do? What do you feel comfortable doing? Well, I feel comfortable, walking down my hall and back 5 times at night. Great. We're going to send you an email. Your alternate standard is to walk down the hall at night. And if you do that, and you can honestly say you have, then you can say you've met the physical activity standard for you and just claim it. And we've got documentation and you're good to go. It's very, very simple. So that's it. Just to summarize really quickly, really health factor, big list of things. Rewards means any positive reward, any penalty. There are 2 kinds of programs. One we called Engage. It's where you just have to engage in something. Whether or not there's a reward, my only requirement is I just had to do it. And it's something that's so simple that it's fair to everybody. The other kind of program we called an Achieve program because you have to achieve some sort of standard that's based on a health factor. You've got to jump over a high jump bar. And that might involve the measurement of health status or some health factor and a requirement to do something different. It might involve me doing some sort of activity that I can't do because of some physical limitation or disability that I have. In either case, there are 5 things you need to do as a wellness program professional in order to adapt the program to meet the needs of your employees. That's pretty much the summary. So with that, what we're going to do is we're going to transition to a question section. Now, this is a time where it's okay for you to begin firing your questions in. But while you're doing that, Jenny's got questions and Steve's got questions. I'm going to answer some of the questions that we commonly get on this. I get several emails a week from people about these sorts of questions. So I'm just going to go ahead and answer these right now. So Dr. Adams, I appreciate everything you said. Is there a simple way that I can check to find out whether or not we're compliant? And I'm talking about HIPAA and GINA and all that stuff. How can I check my compliance? Well, we understand that's a big deal. And so what we did is we developed a tool. It's called the Compliance Checker. You just click on Wellness Tools. You see in the lower right-hand corner, right above Free Webinars. And it's going to take you to the Wellness Compliance Checker, which is a series of very simple questions worded as simply as we possibly could. And at the end of the little interactive survey, it's going to help you understand. If you don't meet a standard, it's going to tell you what you need to do to adapt. It's going to be everything, and you can finish it in about 5 minutes. Bada boom, you're good. So this is a free tool we provide on the wellness website, Wellness Compliance Checker, to help you know whether or not you're compliant with some of this federal legislation. There's a couple of tweaks we're going to make in about 2 weeks to bring this thing up to speed with these recent changes, but it's very, very good. All right, here's another question. Can I store or collect biometric data? So let's say I am a healthcare company for whatever reason. I've got not only people who are qualified to measure medical health status, they do it every day for a living. They've got college degrees and certifications indicating they can do it, and we have the capacity to store that information. Should I collect that information and store it for my own employees? That's a question I get an awful lot. So here's how I answer that question. and I apologize for sounding like an attorney. I always say, where's the burden of proof? So let's say that you work for a really good organization. Good organizations have policies and procedures that involve reviewing employees periodically for their employee performance. And a lot of times, compensation is based on that. Sometimes advancement, progression within the company is based on employee reviews. So let's say that company A is a healthcare organization. It collects its own employee biometric data, um, including blood glucose. So say, for example, in January. Now, fast forward 6 months. In July, they do employee reviews. Based on an employee review, it's determined that one employee, we'll just call him John, is frequently late. He's generally disobedient, not very much fun to work with, and pretty much just an unproductive employee. Not very much fun to work with. So, after all measures to remediate problems that John is having have been taken, everything has been exhausted, the decision is made. We've got another choice but to terminate John. So, John's terminated. Is there anything stopping John after he gets fired from filing a lawsuit claiming that he was terminated because he had high blood glucose? No. Now, so if you've got the blood glucose, you've got it stored in your records, your vault somewhere. Where's the burden of proof? If you collected and you stored the PHI on your employees, it's on you. You've got to prove that you didn't use the information that you have, and John can prove that you have it. You got to prove that you didn't use it to discriminate against them. And I have to tell you, from our experience, that's pretty tricky. This is why it makes a ton of sense, I think, to use a third party where possible. What it does is essentially transfers the burden of proof to the terminated employee, because if you don't have it, they can't show cause that the employer had access to their biometric data. Then the burden of proof shifts to the employee, and that's going to be a lot more difficult for the employee to prove. Now, this is perhaps an extreme condition, but the bottom line, this kind of thing happens every day. And in these types of cases, it doesn't matter whether you're right or wrong. It doesn't matter whether you've done everything perfectly. What matters, what's going to ruin your life, is that you're in court. So you want to try to do everything you can to avoid that. So I see the answer to the question, should we collect and store our own biometric data, is think really, really hard. Make sure you have a team of attorneys advising you before you do something like that. Let's go back to this question again. Can an incentive be given? Or how much incentive can be given? I said earlier, 30% of the total cost of health coverage, and that's generally true. Maybe the question is, I heard that if you do a tobacco cessation program, the incentive can be as high as 50%. Yeah, that's actually true. That's true. That's true. But again, I still don't think that's realistic based on what really costs to insure employers. Remember, employees. In my example, I said if your total cost is $6,000, think about that. Are you going to spend $3,000 to incent an employee to quit smoking? I don't know many people who do that. So again, $50 a month is a lot more typical. How can you find out whether or not you should use a premium differential or have a totally separate health plan? Again, there's another tool that we provided for you for free. It's on the WellSteps website, and all you have to do is click on a link that is wellness budget calculator, and it will help you understand how much money you can save by doing plan design changes, and how much you can save if you use a premium differential. So it's just actually, we built this to help you figure out how you could save money to fund wellness efforts. But this is a great example to use and give you an idea of how much you're really spending. All right. How can I avoid these requirements altogether? I just don't want to mess with this ACA right now. Well, here's the thing. You can stay grandfathered. The way this whole thing rolled out, the government said, well, you can do this, you can, but you don't have to. You can keep your insurance as long as you want. Well, the way it's kind of set up is there really is no choice. At the end of the day, everybody's going to have to jump ship. They're going to have to become what we call ungrandfathered. They're going to have to buy into the system. Just when I share with you these things. So you can stay grandfathered. You can avoid all this ACA mess if you stay on your health plan, but you cannot significantly cut or reduce benefits. You can't raise co-insurance charges. So if the employee pays 20% of a hospital bill, under a grandfathered plan, you can't change that percentage. You've got to limit increases in copayment charges. So, for example, let's say you have a $5 copay for a doctor's visit. It can be increased a little bit, but only within reason. So you can't do a total huge plan redesign where you jack that up, say from $5 to $20. You cannot significantly raise deductibles. They can be raised. There's an allowable amount, but it's tied to medical inflation plus 15 percentage point. So the truth is, allowable increases might be as much as 20 to 25% in any given year, but not any more than that. If you go any higher than that, you lose your grandfathered status. You can't significantly lower employer contributions, so you can't really cost shift. You can't change insurance companies. You can't jump to get a lower rate. Once you do that, you lose your grandfathered status, and then you're subject to all the the elements of ACA on the employer side. And you can't tighten annual limits on what the insurer pays. So, and that's another way of cost shifting. So that's a question that we get often. Once any of these things are done, grandfather status is gone, and all the changes in ACA apply to you. So those are the frequently asked questions that we commonly get about the Affordable Care Act as it relates to wellness. So let's open it up, Steve, to questions that we might have from our attendees today.
Troy, you and I in the beginning knew we were going to get deluged with questions since we've done this a few times, and you've got 1,001 people registered today, so you were correct. Let's start with the idea of the 30% rule for incentives, Troy. Explain exactly where that original number comes from. Is it claims submitted, claims paid? Is it the employer portion, the employee portion? Does it include the cost for dental, vision, prescription? Those questions.
Well, the way it's outlined in ACA, it's the total cost of healthcare. It's the anything the employee pays plus anything the employer pays. I don't know a simpler way to explain that.
What about prescription costs, dental, and vision?
Um, you're putting me on the spot a little bit. I didn't quite memorize all 123 pages, even though I studied it
My,
several
my,
times.
my reading of the bill says no, they are not.
Yeah, that would have been my guess. I didn't want to answer incorrectly.
Well, to the point, we've seen an awful lot of programs. We've seen a lot of reviews of a lot of summaries of programs. A very, very strong average incentive amount for employees to engage. About the most we see on average is about $1,100 a year, which is going to be around $100 a month at the most. Generally, we see $50 a month, sometimes 100. So using the same math you provided earlier, it doesn't matter if the incentive amount is 30% or 35 or 40 or 50. Nobody gets to that 30% amount in any given year. Very, 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 very few. So it's almost irrelevant as to what that number is because the average employer isn't giving that much money away in the form of incentives or penalties.
Yeah, and really, it's just an upward limit. It's the government's way of saying, look, you can reward your head off, knock yourself out, do a wellness program, give out all kinds of money, encourage people to be healthy, but you can't go if you go any higher than this limit. Now you're messing. Now we have concerns about discrimination because there's too much money flowing around. So it's really an upward limit, and underscoring again what I said and what you just said, Steve. We know very few groups, if any, who even approach that 30% limit. So I wouldn't even worry about that, to be honest with you. It's not going to come into play.
We do have some other questions here I want to get to, Troy. Um, Let me get to the ones that I have marked here. There's so many of them here. I wanted to get to the really, really good ones. Here we go. If you have an outcomes-based program and need to give employees an opportunity to qualify annually for the reward, can you waive or reward the employees who've already met the outcomes? My BMI is good, my cholesterol is good. Just reward them rather than have them require them to get screened again when it's really not clinically indicated. In other words, only give the opportunity to rescreen to those who did not meet the target.
Well, that's an interesting question. One of the elements of an outcome-based program is again, you've got that high jump bar. And so if the high jump bar is at 4 feet Just as an example, if I jumped it this year, can I jump it next year? There's going to be a point at which I can no longer jump it. So in what year do you decide to re-administer whatever the standard is, so you can find out whether or not the healthy people who got it last year or the year before that, whether or not they still meet that standard. And I think there's a good reason to do that every year. My reading of the ACA didn't say, well, you've got to redo you've got to reassess every year in order. But I think that the way it's written implicitly, it states that whatever your standard is, you need to assess the entire population. Otherwise, you sort of breach that fairness line. And so, yeah, I think you got to apply the standard every year. Now, if your standard is something like we recommend, which is go to your doctor every year for an annual physical, which has long been recommended as a preventive thing. And by the way, it's free. Steve's going to tell you all about that. And the physician looks at your age and your gender and your health status or risk status or whatever, like we do with our screening reminder tool. Then then what the employee is asked to do is basically, so if I went, I would have one set of recommendations because of my age. But another person who's 10, 20 years younger would have a different set of recommendations based on their health status and their age, but it would be appropriate. So to your point, there's no sense requiring everybody to get all the women in your company to get a mammogram when we know the standards. The best evidence says there's a certain age at which, below that, you don't really need to get a mammogram. It's only above, it used to be 40, now it's 50. You need to get a mammogram. So you can have an impact on what is required based on kind of how you set your program up. I really love the idea of saying, here's your one requirement. Print this form, go to your doctor, get the screenings recommended for your age, your gender, and your risk status, prove that you did it, and you're good. That way it's you got one standard, but it's individual to each, it's individualized for each person.
Okay. Here's one. We offer an 8-week challenge that encourages people to eat fruits and vegetables every day. Participation is voluntary, but to qualify for a prize, you must log 5 servings of at least 5 days a week. Is this health contingent or participatory?
They didn't like that. They didn't like achieve and engage. Well,
No,
those are really big words. I have a hard time saying them. Based on what you just described to me, Steve, that would be a participatory program because the reward is not, they're giving a reward, but it's not based on, so say the question one more time.
we run an 8-week challenge to encourage people to eat fruits and vegetables every day.
It's voluntary.
Participation, it's voluntary to participate, but to qualify for the prize at the end, you have to log 5 servings of fruits and vegetables a week, or at least a day, in 5 days a week. Is this contingent or participatory?
So let's have a dialogue, Steve. Let's pretend like you and I were sitting around the table. We're wellness professionals. We come up with this program. We think it's a great idea. Now let's ask the question. Is that fair? Is that requirement fair for everyone who voluntarily comes?
Yes, because it's voluntary. I don't have to do this if I don't want to. I don't get punished for it. You can't, I'm not being punished because I'm not participating.
So
I don't have to participate.
what about Bob in accounting? What if you want to, so we think through it, we talk about it, we make sure that it's fair. If it's fair for everybody, then it's participatory. If it's fair for
There you have it.
everybody, yeah.
Yeah, it's voluntary. You don't have, the key here is voluntary.
Hmm.
You don't have to do much with that if you don't want to. I know a lot of these questions we're going to have to take off air when you get to these questions again. Which standard does a program fall under that requires employees to participate in an HRA and screening, then stratifies them into a number of coaching sessions they must complete to qualify for a $40 premium differential?
That's a that's an outcomes-based program which falls under it's the second type, health contingent. I called
It's
it.
health contingent all the way.
Health
Yeah.
contingent all the way. Yep. So
And you have to qualify. You have to meet with a coach if you're at risk, and you have to do it. You have to give them alternative standards. That's a classic health contingent one.
Yeah, here's the high jump bar. You can't clear it. You got to go work with somebody until you can.
Um, we offer, let's see, we offer a health screening from biometrics like cholesterol as a way for employees to earn points for our wellness program. This is one of many ways they can earn points for a premium reduction on health insurance. If they choose, they can fill out a form with their data and send back to our wellness coordinator, and they're given the program points. Are we in compliance?
Well, I think the question is, what kind of program am I if I do that?
Well, it's
Is it,
health contingent,
mhm.
but are you providing exceptions, alternate standards for them if for some reason they can't get their biometrics into a range that you want to reward? Can you get a physician's release, so to speak, to not have that? There's the other points the 5 points that you mentioned, Troy, that have to be in place for health contingent. And she can just go through and just check those off. Um, Here's one from I had one in from Colleen Riley. Hello, Colleen. I know you're out there somewhere, and I've got so many questions. I'm trying to find your original question. Are there any rules or requirements about contacting the at-risk portion of your population via mobile phone consumer applications with incentives to engage in various wellness programs?
Not that no, not that I've read. They're
But
just yeah.
if you're an employer and you have their risk data, then you're contacting them through some type of technology. One, you got to make sure that that information follows the HIPAA requirements and is secure. And two, as an employer, if you're using that individual data, you're at risk for what Troy mentioned earlier about the burden of proof if something goes bad. So if you're an outside vendor, that's much easier. If you're an employer, that gets to be a little bit dicey.
Yeah, which is why I always recommend using a third-party vendor. People who are particularly concerned about applying with those elements and avoiding lawsuits, it really is best to use a third-party vendor to help you avoid that. So that's sort of my recommendation on that.
Stephen Cohen, we've heard from Stephen before, and hope your brother Matt's doing well. He asked a question, if you could comment on the other legislation that predates ACA, like ADA and GINA, and how they impact. And I have referred Stephen to the compliance checker,
Hmm.
which was originally designed around HIPAA, ADA, GINA, and ERISA. And that will give them the information they need. Troy, you want to add to that?
Yeah. Just really simply, let's see, how can I summarize? Let's talk about each one separately. First of all, GINA. GINA is Genetic Information Act, and basically, some of you might not be familiar with it. All it does is it prohibits you from. You've got to be fair. You can't use genetic information, which includes family history information, to base on which to base rewards, because that's considered discrimination. It's not fair. And so that act simply prevents us from doing that. Any genetic information that gets collected, including family history information, can't be used to determine whether or not a reward is given. So there was a big scramble a few years ago by HRA companies to ditch the family history questions from their health risk appraisal. Now the ADA is a little trickier. There was a lawsuit brought, I believe it was in Florida, where a customer claimed that he was in violation. He was being discriminated against based on the ADA because his company had administered a health risk appraisal and had done some interventions based on that, and it included questions about things like depression, et cetera, and so on. And so his claim, basically, what the judge said is, the wellness program was a benefit. It was available to all employees, and it was communicated in the health plan documents. Really good health plans will include a description of their wellness program in their health plan documents. Because it was integrated that way, the ruling was in favor of the company, and so that claim was not upheld. And so that's just sort of what I know about ADA.
That's about all the time we have, Troy. We've still got a variety of questions in here. I'm going to include, and I'm going to invite our listeners to go ahead and email us with some of their questions if we can help with some of those. If some of these some of these really really specific questions we may not have the answers for you. Some of them are very very detailed. I know you're hesitant to do that, Troy. There's a few here that are pretty good. I know we're not going to get to. Um, we're at the hour, and it's probably time to move on to the next month's.
All right. Well, I want to thank you everybody for attending. I knew that there would be a lot of questions. I apologize to those of you for whom we couldn't quite get to your questions. Please join us in our next webinar. Wellness Wins, the Prevention Lottery. Dr. Aldana will be presenting that, and will be all of the great benefits that are available for employees because of the Affordable Care Act. Thanks, everybody, and have a great weekend.